May is Mental Health Awareness Month. According to the National Alliance on Mental Illness, about 58 million people experience mental illness each year. That's about 1 in 5 adults. A psychologist from Rogers Behavioral Health will join us each week this month here at 4. Today is Dr. Tyler Rickers. Thank you for your time. We want to talk about the pandemic's lingering impact on mental health. What effects are you still seeing?
We see some positive and negative impacts. The isolation that it brought has been challenging. The social skill development has been slowed for a number of people, especially those folks who are in critical times during the pandemic. People are more isolated, getting less sun, using the internet more. We see stress higher, people sleeping more, and it's been challenging, but also opened our world to virtual treatments, which were necessary to try and help people during the pandemic. So that's one positive that's come from it.
Mental health, it does seem like something that people are talking about more. Why is it important to draw attention to mental health and make sure that we talk about it?
Well, historically, there's a stigma about mental health. If you break your leg, you know to go to the doctor. But if you're feeling blue, you can't motivate yourself to do things. Oftentimes, people won't seek the help they need. And it's important to reduce that stigma, make sure people are getting help, because mental health affects 1 in 5 Americans, and suicide is a potential result of untreated mental health.
You mentioned feeling blue. What would be some common conditions or signs, and when should someone seek help?
Well, with depression, we see lack of energy, decreased concentration, difficulty sleeping or sleeping too much, eating not enough, eating too much. People will feel down, hopeless, helpless, and at times even have suicidal ideations. If these symptoms go on for over a couple of weeks, you're meeting criteria for a major depressive episode, which usually requires some sort of intervention. And the intervention can help reduce the severity and the length of the symptoms as well. Anxiety also can be an issue, and that is more worry, avoidance, and difficulty engaging in life.
What would you say to someone who is needing help but isn't seeking it?
To break down the barriers that are keeping you from going to get the help. Maybe talk to some people that have done it before. Getting help is really important. It's actually more brave to go get help than to not get the help. So don't tough your way through it. Make sure that you're talking to other people. Look at the studies, look at the information. Treatment helps.
Absolutely takes courage to seek help. Thank you, Dr. Rickers, so much for your time this afternoon.
Thank you.
Rogers Behavioral Health has free resources available for all kinds of situations. We have a link to that page on our website. You can go to WISN.com/links.